Good afternoon. As I told you, some of you whose English is not as good as mine, when you use the word honorable in Kiswahili, it doesn't sound really like the real meaning. So if I have to teach you one word when you go back, it's honorable, it's called Mheshimiwa. Sound a little bit better, so we'll say Mheshimiwa Waziri, Honorable Minister. Will I be allowed to use that word as I go in my English? Mheshimiwa Waziri, January Makamba, Minister of State, Vice President's Office, who is responsible for Environment and Union Matters. Susan Urban, Lead of Healthcare Without Harm. Rosemary Kumwenda, UNDP, Eastern Europe, Team Leader for SPSH Coordinator. Senior government officials, and I would like to recognize my two colleagues from the two hospitals, the CEO of two hospitals. I'd like to recognize the CEO, the Executive Director of KCMC, Dr. Gilead Masenga. And I also would like to recognize the presence of Dr. Godlove Mwanji from the Zonal Referral Hospital, the Director General of Zonal Referral Hospital, who is from Mbeya. Government officials who are here, representatives of manufacturers, suppliers, policymakers, civil servants, academia, technical experts, media people who are here, and ladies and gentlemen. Mheshimiwa Waziri, welcome to our event. Karibu sana. We are very proud to have you here today. And when we sent you an invitation, you confirmed this almost 2 months ago. And we have interacted in between, and you have told me I have already booked the date. So asante sana, naomba mpigie makofi Mheshimiwa Waziri. Good afternoon, everyone. Mheshimiwa Waziri, we are glad that we have succeeded to receive 250 manufacturers and suppliers from 40 different countries around the world for this third Medical Stores Department Manufacturers and Suppliers Annual General Meeting and the second Saving Lives Sustainably Global Forum in Africa. Among 250 people participants, the local manufacturers are 85, and we have 165 international manufacturers and suppliers. In these 2 days, participants were familiarized with MSD business processes for prosperity, dimension of sustainable development and production of policies, laws and strategies, including the trade barriers and environmental compliance emerging issues. Apart from that, they were introduced to requirements for marketing authorization and importation of health products, innovation, partnership for sustainable production in health delivery. However, during the parallel session, participants had a chance to discuss various issues with regards to water management for pharmaceuticals in environment and antimicrobial resistance. Mheshimiwa Waziri will be pleased to know we also discussed clean energy. We also discussed process safety management, meaning recycling, packaging, chemical of concern, waste prevention and reduction. The fourth thing we discussed is opportunity for sustainable production across health supply chain, protecting people and the planet. The fifth thing we discussed is the gender equality through women empowerment, strengthen gender equality in the global health supply chain. The sixth thing we discussed is the business ethics and sustainable leadership. The seventh is occupational health and safety investment. And the last but not least, we discussed sustainable index for healthy procurement. Mheshimiwa Waziri, as you are aware, MSD has been selected to start procuring medicine and other medical equipment for the 16 countries from Southern Africa Development Community, SADC. through the process called pooled procurement. At the moment, we are done with the tendering process on the initial phase, and I'm glad to inform you that we were able to receive 80 bidders across the globe. So during this forum, we have illuminated this initiative by focusing on the partnership dimension of sustainable development. We want to be the champion for SADC in sustainable development and clean, healthy environment. As part of MSD and UNDP initiative to safeguard environmental health and human welfare, our conference was environmentally friendly. There was no usage of paper. We were paperless. And no plastic bottles or no glasses. As you can see across the hall, the hall was packed yesterday and this morning. Some of the guys had to fly back because they're catching the flight. And we had the disposable cups. And since we knew you were coming, so we decided to make sure that to impress you. That was part of your, my team tried, that's what they told me. So we can't bring the minister responsible for environment, and the environment looks so unfriendly. So there was no plastic bottles, no glasses. Instead, we have water dispensers and paper glasses. That's why we don't have any printed material, including the timetable. Everything was online. As you are here today, you are responsible for environment. We commend your support in proper implementation of this initiative. We are Tanzania. We are now a plastic bag free. I told the audience yesterday that I flew recently 3 weeks ago. I was flying from Dubai to Dar es Salaam, and I bought a present for my son from the duty free. And the cabin crew told me, "You are going to Dar es Salaam. We have to give it to you without a plastic bag." I was very proud of what we have done. So Mheshimiwa Waziri, kwa kweli tunakupongeza. We know you don't want to be commended on that one, but we have to say it because even Emirates are realizing they have these they are beautiful, but they are plastics, thick plastic bags. Finally, as you did with banning plastic bag, MSD is ahead on this in packaging material, and as we start, we are now currently even selling to the private market the dispensing envelopes that are not plastic. We are using paper dispensing envelopes. So we'll be very soon launching for all the pharmacies in the country. They can come and buy from us the dispensing envelopes, including the local suppliers that are here. We'll print them on your behalf, and you can buy them, and they'll be sold at a very, very affordable price, so that you don't have to run around with the plastic bags. Having said that, I want to say again, Karibu Sana, thank you for finding your time to come and be with us this evening. And I want to assure you that our commitment as MSD, and we are more than happy and ready to listen when you come to close our meeting to any directives that you may have in as far as the environment is concerned. And finally, I want to recognize the partnership that we have had with UNDP. I want to thank them. Mheshimiwa Waziri, UNDP has been really, really supportive. We started with them in Istanbul, and they have championed MSD as a supply chain environmental friendly organization. So we want to thank UNDP, especially the Istanbul office as well as the country office here. Asanteni sana, na Mungu awabariki sana. God bless you all.
Thank you very much, Lauren. Very comprehensive summary of the past 2 days. Your Honor, on the program, Dr. Nguyen Ta Ha, Deputy Director General of Vietnam Health Environment Management Agency, is slated to speak, but she joined us yesterday by video as she had other engagements, and we were very happy that she actually did that. Oh, he's here? Oh, there you are. Okay. I think I should be bringing you up to the podium, sir. I wasn't aware that you're still here. Should we bring him up? Sir, may I please request, if you have any statements to make, even a brief one, to please join us up onto the stage, sir. Please, Karibu, welcome. You are on the program, and just before Lynn Roger Lee, the senior manager, I think not introduced, Strategic Sourcing and Supply Chain Department at the Global Fund speaks.
Does the director have a speech to read for the closure? We can come up to read the speech.
Let's please put our hands together. Sorry, I was not acquainted.
Ladies and gentlemen, and all delegates, today, and we have spent today for the meeting. And in meeting, I think we, representative of organization and owner of manufacturer, supplier, also health facility. All of us have good chance to share lesson and to have good information, which I think many useful information for all of us through in the future. And we know how we have to save life, how we have to save and environment protection. That is good for health, for our planet. So how we have to do, that is the question for all of us, even our representative of government. It means even we have to issue and adopt some policy, but not enough. When we are hearing about your presentation, on the side of manufacturer, supplier, or in the private sector. So I think we have to increasing and to improving about regulation, even the guideline. That is make more detail for all of supplier, manufacturer, know how to reduce their goods and to apply new technology. And I think I am a man standing between this side, manufacturer and supplier, and the other side, it is healthcare, health facility. And we have to set up the good environment for all of us to meet each other. One side want to sell something is good or is bad, and other side, hospital and health facility want to get the good conditions and equipment. So every thing you have present on the meeting today, I will get and to inform to my colleagues in our country, and we want to connect with all of them, and we will to revise our policy and welcome you come to Vietnam investment, and to show all things is bad in your country, and that is the best technique or the best the good. Thank you very much.
Well, that's an invitation I'm definitely going to accept if you will have me. Let's put our hands together once again. Thank you very much, sir. Thank you. Much appreciated. And so on the program, now I'm going to get it right. We're going to call on Mr. Lin to speak, and thereafter be Rosemary. And you will have a special function to perform. I'll let you know in a minute. But in the meantime, let's listen to Mr. Lin Roger Lee. Karibu-san.
Thank you. Excellency, ladies and gentlemen, good afternoon. I'm very, very pleased and happy to be in this forum. The last 2 days, this forum has been very informative, productive. Bring 250 suppliers from 40 different countries. So it's such a unique opportunities for the government officials and suppliers and partners and all the donor funders to discuss the critical issues about the procurement, access to medicines. More important, focus on the really sustainable procurement activity moving forward. I'm really humbled by the initiative taken by the country to ban the plastic bags. I think that is really, really strategic and critical mass to demonstrate the policy, the power of the nation can play to protect the environment, and also bring a lot of benefits to the people living in this country. So as Global Fund, as a part of the SPHS working groups, we are committed working together with partners, suppliers, and other donor government officials to really focus on the response procurement activities to saving lives sustainably. Thank you so much.
Thank you very much, Mr. Lin, Roger Lee. Your Honor, it's my great pleasure to welcome another very dynamic woman, who's had some very engaging panel discussions and very able chair and moderator. Karibu-sana, Mama Rosemary, for your speech. And once again, you have a special function after your speech. And so we're going to request the guest of honor to stand by for it. It's a very noble activity, a very noble gesture from the UNDP to this auditorium, in fact. Karibu-san.
Honorable Minister and dear esteemed participants of this forum, we are so pleased, Healthcare Without Harm and UNDP jointly with MSD, to have finally managed to hold this forum. Honorable Minister, with the support of the Swedish International Development Corporation, the 3 organizations, UNDP, Healthcare Without Harm, and MSD, put our heads together. We started last year to organize this forum, and this year, almost on a bi-weekly basis, we're touching base. The country office of UNDP has been our main interlocutor in organizing the forum discussions with MSD. So we are extremely pleased with how it has panned out in the last 2 days. For a lot of us, it's been a session of learning, a lot of interactive sessions, a lot of networking. We are going back with our pockets full of business cards, and I'm sure we'll start networking if we didn't do so before, and we'll continue to network so that next year, when we hold a similar forum to a venue that is going to be discussed with various countries where we have the SHIP project, we'll be getting back to Tanzania to let you know what the vote will be. But essentially, it might be either in Latin America, either Brazil or Argentina, or it may be in Europe, Moldova, or Ukraine. So we are so pleased that the reach through the 10 countries is enabling us to scale up almost immediately to ensure that we all are looking at and striving forward to ensure sustainability, both environmental and social dimensions of sustainable procurement. We are so pleased that we also touched upon gender, which is a really key focus area that most of us don't pay attention to. But at the same time, we had the hard-hitting anti-corruption discussions in procurement. So we are really, really happy that the dimensions on social sustainability, but also environmental sustainability were touched upon. And waste management is another topical area, and I'm sure through your ministry, we will have to learn a little bit more and support you where you would like to see policy and legislative reviews that require to be done. We are here to support those processes. Honorable Minister, you were told that this meeting tried to reduce our own carbon footprint. We wanted to walk the talk. So in so doing, we had consulted with the management of this beautiful venue, which we are told very soon will be the venue for a SADC meeting. And we were told that they needed support with water decanting points. And we said we don't want to see plastics littering the conference room. So we would like to make a small gesture to hand over these water decanters which we bought jointly with MSD, so that you can hand them over to the venue management, and hopefully they'll be useful for meetings that will take place here after we are gone. So we bought in total 10 dispensers, which have been in this conference room, but also in the breakaway rooms. So, Lorian, I think we need to do this together.
So when is the model? The breakaway. That's the
Thank you for joining the ceremony, Rosemary. And I'm going to call on Mr. Deus Kulwa, the Convention Center Manager, JNICC, to come forward. Bwana Deus Kulwa, karibu sana. Please join us on stage. Honorable Minister, next to you to the left is the Convention Center Manager. Safi kabisa, nashukuru sana. Bwana Deus Kulwa, karibu. Sasa naomba tunaweza tukaitoa irudi katika sehemu yake. Ungeweza kuweka hata machungu makubwa hapo, maji yangekuwa baridi mazuri tu. Kaka Lauren, DG MSD, please, you have the honor of welcoming our chief guest to speak. Karibu sana.
Mheshimiwa Waziri wa Nchi, Ofisi ya Rais, Ofisi ya Makamu wa Rais, Mazingira na Muungano, in English, the Minister of State, Vice President's Office, responsible for Environment and Union Matters, the union between Tanzania and Tanganyika and Zanzibar, which makes it Tanzania. I have the honor to invite you to address and close our ceremony. Karibu sana Mheshimiwa.
right, thank you. Thank you for that. Although as politicians, every politician has a huge hole in their heart, and that hole can only be filled by applause. So I don't think the applause was sufficient enough to fill my hole. That sounds like it. That sounds like it. So I'm very happy to be here, and thank you, DG of MSD, friends from embassies and development partners and international organizations, our friends from CEDA, from UNDP, representatives of the private sector, manufacturers and suppliers, government officials, distinguished participants, ladies and gentlemen, all protocol observed. So I usually don't like to read speeches, but my people told me that this is a very important audience and you don't want to be off message, so we wrote something. So I'm going to read it, and then later I'm going to say what I wanted to say anyway. So I would like to thank MSD for inviting me. As the DG mentioned, we planned this for a long time, and as you know, Lauren is very organized, and here if you ask a politician to commit for something 2 months later, you know that you're risking. But we committed, and we're here, so I thank you for the honor that you gave me to come and be part of this important meeting. I want to thank all the partners who have made this possible, the support, UNDP, Healthcare Without Harm, and local manufacturers, international manufacturers, the MSD family, and KCMC, Mbeya Referral Hospital, CEDA, and others. I thank you for your support, and thank you for participating. So I am responsible, Minister responsible for the environment, and as a country we have made great strides in the protection of the environment, and I was very happy and very pleased that this meeting took note of the importance of environmental protection in all that you do, and the side events that took place during the margins of the sessions have certainly drawn our attention to various issues that require our strictest consideration. As such, the 2030 Agenda for Sustainable Development is a strong-minded to safeguard the globe from all sorts of environmental harm through sustainable investment, production, procurement, consumption, and disposal of health commodities by captivating a pressing act on climate change. This envisaged the concept of healthcare without harm. Distinguished participants, the connection between climate change and human and environmental health is inseparable. To human included, induced climate change and the environmental degradation due to the production and consumption of health products that can put us past critical threshold related to the health of the planet and the health of human beings. And as an innovative way of doing business and creating value, there's a need of producing healthcare products that uses processes that minimizes the negative environmental impact, that conserve energy and natural resources, and are safe for employees, communities, and to make sure that consumers are also protected and they are indeed economically sound. I commend all stakeholders who attended this session from across the world and across the global healthcare industry to focus on elimination of these problems, ranging from environmental degradation to antibiotic resistance caused by pollution, to the intensive use of water and energy, and from the handling of hazardous waste to occupational health and safety risk. Also, given their extensive scale and their mission-driven interests in improving human health, suppliers and manufacturers operating in this sector have the potential to become leaders in the transition of the entire economy towards sustainable products and practices. The suppliers and manufacturers must ascertain for good practices in sustainable healthcare production and simultaneously can implement changes to generate positive social, environmental, and financial benefits. Our office, as you know, is mandated in coordinating all environmental management issues. And the overall function of the office is to formulate policy on environment, coordination and monitoring of environmental issues, environmental planning, and policy-oriented environmental research. The Vice President Office is the core coordinating body for implementing our Environmental Management Act, and the National Climate Change Strategy has been working for a while with the development partners with the aim of to build a coordinated development partner response to the government's joint assistance strategy for Tanzania within an overarching framework of National Development Plan. Over the years, the nature and objective of our engagement with the development partners has evolved, and today the DPGE provides a platform for active environmental, natural resources and climate change to conduct a structured policy dialogue between the development partners and government and other partners in related policy areas to ensure coordination and harmonization of projects and programs and promote joint advocacy and communication vis-à-vis the government and other stakeholders. Tanzania is a pilot country to a set of sustainable health procurement practices and policies that synergize with the UN Sustainable Procurement in the Health Sector initiative of greening the global health sector, is ready to take this initiative positively in order to reduce the toxicity of chemicals and materials in health products that might be harmful to people and the environment, and also to reduce greenhouse gases in the supply chain and the conservation of resources. On behalf of the government, I want to thank all the stakeholders who pioneered for this initiative, and as government, you will have our full support, and we are politically willing to enhance this project and many others to come. I urge all stakeholders to continue to strengthen their cooperation, taking into cognizance of the major role of the project in the promotion and protection of human health, and continue launching and implementing initiatives aiming at addressing them in the globe. Human health is our collective responsibility, and hence no one should be a bystander in this role. Ladies and gentlemen, let me once again take this opportunity to express my profound gratitude to MSD and UNDP for co-hosting this session and creating a conducive environment with excellent facilities to ensure the success of the session. I also want to recognize and thank and congratulate my colleague, Minister for Health, who was here yesterday, my sister from the same region in Tanga, for hard work and dedication and commitment to the cause of health sector advancement and promotion in the country. Now, we, as I have mentioned in the speech, the link between climate change, environment, and health outcomes are clear. They are established. There is no debate. We have had many studies for over the years telling us that we have new diseases, the geographical spread of diseases have increased, the virulence and resistance to drugs by some microbes are increasing. Even the speed of spread of diseases has been established. So we don't need to argue with too much effort about the link between climate change, environment, and health outcomes. So that's clear. Now all of us are in the business of saving lives, whether you are a medical professional or an industrialist who is producing syringes, or a logistics person who makes sure that drugs move faster. Our business is saving lives. But the key thing is, and that's the right thing, but the key thing is that we have to do the right thing the right way. Because in most cases, in people who are in these endeavors of helping people, saving lives, the noble objectives, sometimes we end up doing more harm than good at the end of the day. So one hopes that there will be a transformation in the business that you're in of saving lives to make sure that we do it the right way. And how do we do that? One, I mentioned in speech, is the production processes for medical equipment and supplies. The way we produce these equipments, the way we produce this supply. Two, the products themselves. Are they green enough? Are they sustainable enough? And third, the way they're produced and applied. To what extent do they consume energy? We know that most popular medical equipment, let's say CAT scanners, respirators, dialysis machines, they consume an immense amount of energy. And where does that energy come from? Fossil fuels. So you may have these good, nice, important equipments that saves lives, but at the end of the day, if they contribute more to emissions, you're doing harm while doing good. The idea is to do good without doing harm. So our hope is that the industry will be transformed in a manner that takes into consideration all these things that I have mentioned. Now, here in Tanzania, we face particular challenges, for instance, to do with medical waste disposal. DG of MSD mentioned that, I think in the briefing, people are scared to walk barefoot in our beaches here because you are likely to encounter a syringe. A few months ago, a young lady came to my office with 2 huge boxes, and she insisted that she wanted to see the minister, and she was adamant, and I welcomed her in my office. So she came and opened these 2 huge, she was getting help, 2 huge boxes. And all these boxes were filled with syringes and small bottles with blood and all these things. And I said, where did you get them? She got them at a very nice beach here in Tanzania. It's Bongoyo Island in Budia, right? So as she was enjoying her weekend there, all these things were washed ashore. And she made it a cause that every weekend her and her friends would walk in all beaches around Dar es Salaam to collect medical waste. It's a huge challenge, and it's compounded by a challenging capacity for municipals to manage general waste. Forget about medical waste, just the normal waste. It's difficult. So with the liberalization of health services in Tanzania, not so long ago, healthcare and health services was only done by government. And later we liberalized, and private people can open clinics. And so we had a multiplication of primary healthcare and even other high-level healthcare facilities. And that created a challenge because the management of medical waste was almost an afterthought. Right? The key thing for us was to make sure that we advance access. And then afterwards, is what happens to all these things that are being produced there. So this is a challenge that we face. We are at the moment writing a new regulation to manage medical waste. And I will sign these in the next 2 to 3 weeks. And these regulations will set standards and requirements for management of medical waste, because it's becoming almost a crisis now. So now you guys are in the huge industry. They say healthcare industry is a massive one, with a lot of people in it, a lot of money, big infrastructure, supply chains, and everything. They say US alone, healthcare system, its size, if it was an economy, GDP will be 3.3 trillion GDP, US healthcare alone. So the implication of this size means also your footprint, your carbon footprint is also massive, right? We know that a country that leads the world in CO2 emissions is the US, number one. And in the US, 10% of emissions comes from healthcare. Right? So if US is leading the global in the CO2 emissions and healthcare is 10%, imagine that proportion globally. And so we feel that there is a special responsibility, given your size of the footprint, to do something to make sure that we change the course. We know that, and there are examples in which hospitals and manufacturers and suppliers have taken a right approach. There are examples of hospitals that have gone 100% green or have been carbon neutral. So this is possible. It's not a pipe dream. It's happening everywhere. And I think that there ought to be, at least from our party in government, a particular effort to make sure that this is the case, and it is either being legislated or regulated to make sure that there are also some requirements in which hospitals and manufacturers are compelled to do something to reduce its carbon footprint. And it's good business, by the way. I was reading somewhere where there is within UK NHS, is something they call Sustainable Development Unit. And they estimated that the cumulative savings over a certain period of time from energy measures where they reduced CO2 by only 11%. The cumulative saving was $2.4 billion. So this is not going green is not a requirement to make business difficult. It's a requirement to make business sound and sustainable and actually profitable. So I think this is possible, and I think that it is possible either within an industry to create a certain parameters, scorecard, whatever you want to call it, or index, to ask, for instance, MSD, before procurement, you could ask your suppliers a certain set of questions about the stuff that they sell to you, right? And this should be designed to push manufacturers to lean toward green. That you win a tender if you can prove that that syringe was produced in a factory where you don't use coal, for instance, right? Things of that nature, or the type of packaging, and so forth. So MSD and similar entities actually were very powerful to drive change in this area. Finally, as you know, we are in what I call a disposable economy. Growing up, my memory of injection was a syringe that has just been boiled, right? So the syringe is super scary. Imagine it being boiled, and psychologically you think that makes it much more painful. So we grew up with equipment that you know, yeah. But we don't see them these days, you know, at all. And not only syringe, many other products. I grew up with nappies. You know, who has seen a nappy last time? Nobody. We're in the diapers. You know? This stuff that we say environmentally sound, we didn't grow up with it. So you use that one and you go dump it. So almost everything these days is disposable, even a camera, right? And so that's one trend that's happening, even in our countries that are supposedly poor. You find poor people increasingly affording disposable goods. So that's one trend. Another is the expansion of the middle class. You know, the more money you have, the more trash you produce. You know? So the more people are in the middle class, the more garbage that our countries will produce. That's another trend. Our countries are growing, the middle classes are expanding. The last trend is technology. Things are changing so fast that the nature of medical products are changing every day, and what they can do and how they can be disposed and so forth. So these trends are creating particular and interesting policy challenges for us. And we have particular responsibilities as a government to work with you to make sure that these trends do not impact our countries as far as environment and waste management. There are many ways. You know, we talk about incineration is one way, but incineration is extremely energy intensive. There's a different way. Mr. Rugamba was telling me of disposing medical waste. That's also benefits of technology. So I think that we can work together with you. I believe that we live in exciting times where things are changing so fast, even how to transport medical supplies, how to catalog them, how to count stuff, and how to hold each other accountable in the entire supply chain. As government and as people who are responsible for environmental management, we are hopeful that the fact that you have given this importance encourages us. Conversation is always the beginning, and we have had conversations. I'm hopeful that all of you are people of goodwill, and definitely we will work together to make sure that all that we aspire is attained. So to all that are traveling, welcome to Tanzania again. I wish you a safe journey, and we're happy to be here. So thank you so much for the honor that you gave me to address you. Thank you. Now, I suppose this is where we say, do we say that the meeting? Okay. Now, with sadness, I say that the meeting is officially closed.
I think that's appropriate. You can't say I'm grateful that the meeting is closed. Thank you very much, Your Honor. We'd love to take a picture with you right now if you don't mind. And I'm going to call forward a couple of groups. There are not too many of us. I think today we'll all fit into the picture. So we'll begin with the manufacturers. Please, may I request that you stand and fill up the stage left and right. And then we'll go to the presenters, the panelists, speakers. So manufacturers, karibuni sana. Welcome up onto the stage. And let's put our hands together